right. So today on the Nurse Coach Duo, I am super excited to interview my co-host, Angie. Yay!
Hi, Jen.
Angie is a nurse of 30 years. She is a wife, a mom, a dog mom, a runner, and a menopause warrior. She's not only a fantastic nurse coach that I have had the honor of knowing and working with, but someone who truly inspires me with her passion for empowering women in this phase in our life. So let's dive in. Angie, are you ready to roll?
Great. Yeah, I'm ready.
Awesome. All right. So I was wondering if you could start out by just telling us what inspired you to become a nurse coach.
What inspired me to become a nurse coach is after all these years of working as a nurse with patients, clients, I really wanted the opportunity to work with people one on one and have the opportunity to really dig deep into people's health and wellness with them. And and also to start my own business and to be an entrepreneur and add my create the, combine the art and science of nursing, which it truly is.
I love that. I think so many people think that as nurses, all we can do is bedside. So starting your
Mm-hmm.
own business is really cool. That's great. Well, thank you.
Yeah.
So what made you decide to kind of focus on menopause and women's health?
Well, through my nursing career, the last 15 years, so half of it, I've worked with women in mostly in peripartum, postpartum, and so maternal child health. I've done a lot of, prenatal education. And so I've been working with women at that time of life and have enjoyed that work. And being that much older, also being in midlife, being perimenopausal, shortly to enter being postmenopausal, I feel just it's a calling really, and so I'm very passionate about working with women in midlife now, and just knowing that it's a complex time for people, women and men, but my focus is working with women. And it's a complex, interesting, things are changing, not only in our bodies, but our environments and workplace. I think there's just lots of changes. And so I'm just super passionate to support and educate and partner and all the rest with women,
Yeah,
with my clients.
that's awesome. Yeah, and following your passion. I mean, who doesn't want to do that, right? So digging in and
Finding
helping.
our purpose, right?
Yeah, absolutely.
Yep.
That's fantastic. So I'd like you to tell us a little bit more about like the nurse coach part of it. What is a nurse coach and why does that give you more of a unique approach to helping women in this phase of our life compared, to what's already out there? A nurse coaches give maybe a different aspect.
Mm-hmm. Well, as nurse coaches, we look at the whole being, right? So we're coming in um, with a more holistic approach. So certainly looking at, we start with, we use a nursing assessment in the way we work with women or with our clients, and or sorry, their nursing process, if you will. We start with a thorough assessment, head to toe. We look at all areas of wellness. And so we really are looking at the whole being and working with people with, where they are today and to help them move forward and reach their optimal health and wellness, which, again, we meet people in all, that aren't moving, are moving, are eating really already eating the Mediterranean diet, and they don't, what else can they do? And so or not, they don't even know what the Mediterranean diet is, right? Or what sugar does, or how sugar affects us. And anyway, so it's just, the nurse coach brings a real special relationship and can have the time to really dig deep, like I already said, from answering the previous question, to people's wellness and where they are right now.
Yeah. Yeah, I love that. I love the term, the art and science, right?
Mm-hmm.
Because we learn so much science in nursing, but there really is an art to it to be able to
Mm-hmm.
apply it and then to take it into a coaching realm and apply it in this way. I think you're right. I think it's just a totally different aspect of not just nursing, but of the way that people are cared for. So thank you for that explanation. I
Yes.
think that definitely makes
Yes.
sense.
Well, certainly asking the questions that nurses in hospital clinic settings, or even triage nurse that you may call in, with an issue, they're not, they're not skilled, and they don't have the time to coach you in those calls. They're certainly educating you, and they're doing brilliant work. This is just another facet of what nurses can do, because we bring so much experience and intuition and medical knowledge that to our clients. And then you bring in motivational interviewing and goal setting and follow up, accountability. So it's just a whole nother realm of what a nurse can do. And,
Yeah.
it's just really a special role. And
Yeah.
it's a newer specialty. And so many people don't understand what we do, right? And it's part of what I've been doing for the last 8 months is, what is a nurse coach, right? And what can we do? And I mean, we're getting there, but
Yeah.
I think I really do feel like people see us in the hospital, people see us in the clinics, and educating, telling us what to do. A nurse tells you kind of what to do, right? The follow-up care, the
Yeah.
discharge plan. And we're going to the next step. We are maybe looking at that plan and putting it into action, or help. We're not putting it in action, but we are facilitating how to put it into action.
Yeah. Yeah. Love that. Thank you. So I know that you work primarily with nurses and also with menopausal women. You kind of have two sides of who you're working with. So I'd love to find out, because since we focus so much on menopause, what is, there's over 103 symptoms that a woman can have going through this phase of our life, and which is just crazy. Tell me either like what the craziest symptom you've heard from your clients, or one that maybe shocked you, whether it's a personal experience or it's somebody that has talked to you about it, where you are finding that, like, wow, that symptom, I can't believe it. No wonder,
Mm-hmm. Mm-hmm. Gosh, I know. I think the first that comes to mind is like itchy ears. People have like itchy ears and they don't know why. And you know, why is probably that we are just we are our skin, all in all, head to toe, is drier. We're just drier, and I don't know if that's particular why our ears are itching. I did not have that symptom, but I've heard it from several clients. People that I've taken my menopause education class have reported that. I think one of the symptoms that I am fascinated by, and I've heard many women in the past few years, but I didn't know it was related to our declining hormones, is frozen shoulder.
Yeah.
And that is sort of just mind-boggling to me. And what happens is people have this, frozen shoulder all of a sudden, right? There seems like it comes out of the blue. Again, it wasn't one of my symptoms, but I do, and then it's this process of trying to figure out what it is. And so you're going to, well, you have to go see your doctor, then your physical therapist. And then, gosh, sometimes people have like symptoms like sort of that nerve pain down their arms. And so they may be going to a neurologist too to be evaluated. It's just I hope it becomes a more known symptom, that it is part of the musculoskeletal syndrome of menopause. It can be, but of
Yeah.
course, I am a big believer as nurses, Jen, I think you would agree with me. we want things to be worked up. We're not,
Yes.
we're not advocating for just someone walking in and being like, this is perimenopause, this is menopause. This is a discussion with your provider. But we want, Jen and I want you to know the symptoms and be aware of your options of care in midlife. And so just to get it out there and start the discussion
Yeah.
and have some real talk.
Yeah, I love that you chose frozen shoulder because actually at 38, that was my first symptom. But it took
Oh,
about 7 years before I found someone to tell me that it was frozen shoulder, and probably a couple more years to find out that that was part
oh
of
my gosh.
menopause. Had no idea. And so part of what I've been doing is when I go talk to a chiropractor about how we can work together, I say, please,
Mm.
when this,
Yeah, that's
because
awesome.
like you said, you're going to all these different doctors. They usually end up at chiropractors, and these chiropractors
Mm.
don't know. Personal
Mm-hmm.
trainers don't know. So like, yeah, it's
Yeah.
getting the word out, and that's what I think we really hope to do with this is not only
Mm-hmm.
just the word, but getting some practical advice on how to manage things as well. So.
Yes.
Yeah, that's a good
Yes.
one. That's a good one because you're right. I think that a lot of people have it and don't have any idea. And it literally, like people say, it's overnight. I was literally at my computer and my shoulder stopped working. Just
Mm-hmm.
out of the blue, no reason,
Mm-hmm.
no injury, no nothing. So it
Mm-hmm.
is real.
Mm-hmm.
And at 38, that was really early. So
Mm-hmm.
nobody would have ever even thought that was that. So, but
Mm-hmm.
this is not my interview. This is your interview. So.
No, it's
I
good.
just thought that was really funny that that's the one you
Yeah.
chose. I completely
Yeah.
agree. Yeah. So, all right. So what's, we're talking about all these different symptoms and how
Mm-hmm.
life changes. I think a lot of people tend to only focus on the negative. I would love to know from you, um, probably a personal anecdote of
Mm-hmm.
what you think the best part of going through the changes.
Oh, oh, this is such a great question. The best part, I think one of the best parts about midlife is and moving through the perimenopausal, menopausal years into postmenopause is just the growth, the wisdom, looking back of like what I've accomplished, what I haven't accomplished, how I, um, how I want to move forward and really, myself, in my career, my family, my relationships. And then that brings me to is like, I feel like I have met some of the most amazing people, including you, Jen, in the last couple of years. And those are, I kind of think, okay, these are my midlife friends. Like it's
Yeah.
interesting, right? Because we have all these different times in our life. And sometimes we lose focus of that. Like where are we going? And like, and some people, I know I've heard some people talk about it's really hard to make friends
Yeah.
in midlife and you can feel isolated and especially if you're not feeling well it can be a lonely time and I feel like fortunately I've had the opportunity I think probably starting a small business also and getting out there and meeting people that I never would have met if I didn't become a nurse coach and the collaboration with other healthcare providers has been significant and not only for myself but also what I'm learning from my clients and what I can take to them and who I can refer to because I did not mention this earlier but what nurses do best or one of their greatest skills and nurse coaches is we connect people clients we've done it for our friends for years but we connect you to where you need to go. We refer out. We know our boundaries. We know our skills. We are amazing assessors, and then we take that outward with you.
Yeah.
Um, and the beautiful thing about being a nurse coach and working one-on-one with someone is you can really, I don't like to say handhold because it is patient led, but we are there. We're there for you when you need us. Because this process, this time can be complicated, as I already said. But sorry, I'm getting off on a tangent. But I think midlife friends is amazing,
That's
are
great.
amazing, and yeah. So I hope that answered your question.
It absolutely did. Yeah. Finding a bond by the things that we're going through for sure. And I do think it is harder as we get older to meet people that we, become friends with because everybody already has the established friends. So I love that. It's a great way, we spend so much time talking about the negative and the symptoms that to find out like that there's positives. There is a lot of great positives to this side
Mhm.
of our years and our other third of our
Mhm.
life. So
Yes.
well, to finish this off, Angie, I'd love to just have you, if you had, and I know this is super hard, but just one piece of advice to give women that are navigating all of these changes. If you had one piece that you had to narrow it down to, what would it be?
I think advice or what I want for women in midlife is to, continue the conversation. Like, you are not in this alone. Find a medical provider, find a friend, find a coach, nurse coach, fitness coach, whatever. Find your yoga instructor, whoever you are comfortable talking. If you're not feeling good and you don't know why, continue the conversation. And then once you figure out why, and you have found a provider that will listen and has shared decision making with you in this time of life, tell your friends, tell your sisters, tell your people, and continue the conversation. You aren't alone, and there should be no stigma around menopause. Like, this is sort of the normality of life, right? And one of my best books that I have found in the last year is by Dr. Lisa Mosini. It's The Menopause Brain. And she talks about the three P's: puberty, postpartum, and perimenopause, the three P's. And let's normalize it. It's just the third P that we're all going to go through. If we're lucky enough to be healthy enough and to be alive, we are going to go through it. So let's normalize it.
Love that. Best piece of advice. Normalize the conversation. Well, Angie, this has
Mhm.
been awesome. I know that everyone listening is going to find this super beneficial and to get to learn a little bit about you. So I really appreciate your time. I ask everyone to please subscribe on that button down there and follow us for future episodes where we are going to continue tackling menopause and great conversations with experts and getting you some advice that you need. Leave us a comment if you have any questions. Thanks again.
Thanks, Jen. Thanks for having me.
Bye.
See you soon, everybody. Subscribe. Yay.
All right, Angie, here we go.
All
Rapid
right, here we
fire
go.
questions. Ready?
Woo!
Coffee or
Mhm.
tea?
Coffee, black.
Black. Cats or dogs?
Black. Ooh, dogs. I have two dogs and one cat, so I have to say dogs. Golden retrievers. I got two.
Comedy or horror?
Ooh, comedy.
Yay.
Mhm.
Favorite self practice. Oh, sorry. Favorite self-care practice.
Favorite self-care practice has to be movement of any kind. And I try to move every day, and that means walking, gardening, running, biking, yoga type movements,
Love
just
it.
moving.
Just move.
Just
Forgetting
move.
names or losing your keys? Which one happens more often?
Oh, forgetting names. Hmm.
Awful, isn't it? Awful.
Hmm.
What is your favorite go-to energy booster?
Ooh, I think energy booster is cup of coffee, but I try not to do that midday. I think just like getting up, some jumping jacks, a little dance,
Yeah.
a little shake it out. But then also just maybe a quick text to a friend or my husband or my kids
Yeah. Oh,
and see if
cute.
they're out there. That gives
Sweet.
me energy.
All right, last one. One thing you wish you would have known about midlife.
Mm. If I had to pick one, I wish I would have known the mood fluctuation that can occur. And again, not for everybody, but it's more common than not, meaning mood instability, when our hormones are decreasing, and also more erratic in this perimenopausal stage. And I guess I just wish I would have understood that more. I'm 52. I wish I would have known that 10 years ago,
Yeah.
especially when I had three or two teenagers and, one younger. But as they're going through their life and their happenings, I wish I just knew a little bit more, and I could have focused on a little bit more of what I was doing or
Yeah.
what was going on with my life too. So
Yeah.
no one told me,
No
but
one
that's
told
why we're
us.
here.
That is
We're here.
why we're here. All right. You know what? Bonus question. Beach or
Okay.
mountains?
Ooh, beach. But how about beach with mountains like
Ah,
right
love
here?
it. Absolutely. Absolutely. Awesome. Thank you.